Beauty industry is always evolving and there's always new advancements that are being introduced. How do you stay in the know? Well, that's why we invited Dr. Melanie Palm with Art of Skin MD here in studio to give us the 411 on the new beauty trends. Good morning, Dr. Melanie.
Good morning,
nice to
Liz.
see you. Let's talk about these neurotoxins or neuromodulants, as you guys in the dermatology field like to refer to them. We're talking about like Botox. There's constantly new advancements when it comes to these things.
So I think sometimes, I'm big on just patient education. So I think sometimes patients are surprised when they ask for Botox that there's actually 4 products that are FDA approved on the market currently. And there's probably going to be a 5th one in 2020 that's available for injection to take away frown lines and for foreheads and working around the eyes. So I did bring, just a little image of the 4th one. So Botox was actually the first. Dysport was second. Xeomin was third. And now we have Jeuveau, which is a little bit hard to pronounce, but it's nice. It's causing some competition in the market, which I think is great for patients. Because
why? Because it brings the price down a little bit?
We'll see. And this one is actually sort of pivoted as a premium product. And what's interesting is when a drug is FDA approved, so Botox was approved almost 30 years ago, it's approved for the indication, it's approved for the drug, but it's also the manufacturing process. And as you can imagine, in the last 2 to 3 decades, things have advanced a lot in terms of technological advancements in manufacturing. So some of these newer toxins have the ability in the manufacturing process to purify things better, to freeze dry it or air dry it instead of freeze drying it into the bottle, which may mean that we see differing results in patients. I tell patients, our biochemistry is different. One of these neurotoxins may be better suited for you, and the only way you know to do it is to kind of taste test and try them out.
Botox came out 30 years ago.
It's been
almost.
Almost
30 years.
It was used in medical applications, things like cerebral palsy in children, people that had what we call blepharospasm or sort of twitching around the eye, and then these lovely cosmetic sort of effects were seen almost as a side effect of treating some of these areas in the face. And obviously it's really revolutionized how we treat beauty in the dermatology office.
Wow, so here we are, fast forward to today, we now have 4 different types of these types of products out there. And then I can just imagine, there's going to be more in the near future.
There is. And I think it's really important, talk to your physician or injector about the product. Demand that you actually see the bottle if you want to. There's a lot of gray market out there. You want to ask them how they're procuring the product and make sure that you're getting genuine product. Because if something is too cheap, it seems like too good of a deal, sometimes it's something that's being procured in not appropriate channels.
That is some great advice, because oftentimes you walk into a medical beauty clinic and you're really not sure. You may not know. You may just think that there's only Botox.
Sure.
You may not be in the know that there are other options. So it's important, I think, that we be empowered before we walk in the door to see you, so that we can ask those questions and say, is this all you have? Do you have other products? And then get educated on whether or not one is better for our type of skin.
Absolutely.
Right?
And then I advise people, it's not the paint or the paintbrush, it's the artist behind it. So, there's a lot of different areas we can inject these and create sort of pleasing results in the face that are natural looking and not frozen. So I think it really is important who the injector is.
Let's take a look at some of the before and after pictures that you submitted to us, so we can kind of take a look at, what are some of the effects here?
So these are some of the before and afters of another device. It's a radio frequency device that we have for cellulite. I think we have a couple of photos that are faces, and you'll see nice, really sort of natural looking results. So there's a before and after. And what I think is important is people look great at animation as well as they do at repose, meaning standing still, but when they're expressing themselves, you can see in this patient, she still looks like she has a lovely smile that's authentic. And I think that's really important when we're doing very natural looking results. She's raising her eyebrows. She can still raise her eyebrows, but she's just not creating those forehead lines. So I think that's really, really important.
Do you know which other products she used?
She actually had a Jeuveau. So this is an example of the newer toxin. And I think in experienced hands, a lot of these can have the same effect. In this particular patient, the onset was 3 days for her. So we usually see 3 to 7 days in onset, depending on the neurotoxin or neuromodulator we're using.
Out of the 4, which one lasts the longest?
So we get get asked that a lot. And, you know, I think it depends a lot on the patient. You know, I've been receiving Botox, Dysport, Xeomin, or Jeuveau for almost 14 years in my face, so I can get away with 5 or 6 months before I have to redose myself. Other patients sometimes need 2.5 months, 3 months. It also depends on how much you're dosing. Lighter dosing that looks a little bit more natural doesn't last as long. If you're getting walloped with a big dose, then it tends to stay a little bit longer. So that's important for patients to understand too.
Very good. Thank you for
Yeah,
the latest
no,
and the
my
greatest on
pleasure.
these beauty trends and advancements. Always good to stay in the know before we walk into an office.
Yeah,
right?
thank you, Liz.
Thank you, Dr. Melanie Palm with Art of Skin MD.